Welcome, everyone. Thank you for joining us today. My name is Dr. Kevin Steele, and I'll be your host for today's webinar entitled, Fashion Footwear Does Not Belong in Medicine or Fitness. This webinar is brought to you by the MedFit Education Foundation, a nonprofit foundation having express goal of delivering advanced information and education on the prevention, management, and rehabilitation of chronic diseases and other medical conditions, as well as preserving the quality of life for those who live with these conditions. Proceeds collected via the delivery of these webinars benefit this foundation, so we thank you very much for your support. Today, we are pleased to have back with us Dr. Ray McClanahan. He attended Pennsylvania College of Podiatric Medicine, now Temple University School of Podiatric Medicine. He's a former competitive athlete. He's still an athlete. There's no such thing as former, and an active runner. In his 18 years as a podiatrist, he has learned that most foot problems can be corrected by restoring natural foot function. He is the inventor of Correct Toes, which silicone toe spacers designed to help rehabilitate feet from the negative effects of conventionally shaped footwear. Dr. McClanahan is also in private practice, Northwest Foot and Ankle, located in Portland, Oregon. He cares for those who find their highest joy when in motion. Dr. Ray's professional goal is to provide quality natural foot health services with an emphasis on sports medicine, preventive and conservative options, and education on proper footwear. So thank you, Dr. Ray, in advance for sharing your knowledge and expertise with us today, which will undoubtedly have a positive impact on our listeners' businesses. So take it away, and we'll enjoy your presentation.
Awesome. Thank you very much, Dr. Steele. Good morning, everybody. I'm very excited to share this time with you and talk about feet and talk about footwear. But I would also like to take this moment just to say a special thank you to MedFit and to Lisa and to Liz and to Tony and to Dr. Steele, who have taken the time to put this webinar together. So today we're going to talk a little bit about footwear and some of the negative features that it has on our feet. And we'll have a moment at the end of our time together to cover a few questions that you folks might have. So let's dive in. So any of you that are parents in the room would confirm that at birth, the baby that was born into your family had a foot shape like what you all are seeing here. And what I want to draw your attention to is the fact that at birth, we are born with the widest part of our foot, the very tips of the toes. And the toes are spaced and independently strong and flexible. Interestingly, here in Oregon, when babies are born, we actually ink their feet and we put their footprints on either the birth certificate or what you see here. This is my older daughter's footprints at birth. And after looking at baby feet for 25 years, I could say that I've only ever seen a few baby feet, maybe less than 5, that did not look exactly like my daughter's feet here. Again, you'll notice that the ball of the foot is not the widest part of the foot. The widest part is at the tips of the toes. In the center of the screen is actually my own baby shoe from 53 years ago. Again, you'll notice that the widest part of the shoe is at the tips of the toes, not at the ball of the foot. My running coach brought me his JCPenney running shoes from when he was a little boy. And what you see on the right graphic is what was printed into the top of that box. In other words, JCPenney used to make shoes for children and infants that were actually properly sized by this sizing system. In other words, they were widest at the tips of the toes. So all is good in America and other industrialized societies for about 1 year of our lives. At about age 2 or 3, we begin fitting children's feet into footwear that's not shaped like their feet, and most people persist that way for decades. So consequently, the structure of the foot and the shape of the foot that I see in my practice, in fact, many of you listening to this might have the same shape too, is the kind of foot that you see here in front of you. You'll notice that the tips of the toes are not the widest part of the foot. The widest part of the foot is actually at the ball of the foot. So this is what most people are going to look like in America. A lot of us look at each other's feet, looks like this, so we're not too concerned about it. What's the problem? Well, here's what we've discovered the problem to be. We come into the world with healthy baby feet spread widest at the tips of the toes. By about age 2 or 3, if you begin looking at what shoes are available for infants and toddlers, you'll notice that they are basically miniature versions of adult footwear. So in other words, the widest part of the shoe is going to be at the ball of the foot. Consequently, the center graphic there is ultimately what most people's feet that come to my clinic look like. We photograph everybody's feet that come in the clinic, mostly to demonstrate that they are widest at the ball, but to also give them the baseline to see their feet changing over time as we rehabilitate them back to natural function, which is what I'm excited to share with you folks today. So we come into the world properly. Unfortunately, we get steered in the wrong direction by footwear. However, I have a very hopeful message for all of you today, and that is that we do not necessarily have to tolerate some of the foot deformities and foot problems that we experience. There's actually a very natural, non-invasive, cost-effective way to actually move our feet back to their natural alignment. And that's what we're going to spend some time with this morning. It's been what I've been focusing on for 20 some years now. And I'm really excited to share it with you and hope that you can implement it in your life. So if you were to come to our clinic and visit with us, the first thing we would do is show you baby footprints. I'd show you my daughter's footprints. I'd show you maybe my baby's shoe. But the next thing that I would do is I would pull out these devices that you see here. Probably everybody listening has seen these in a store somewhere. They've been around since 1927. These devices, called the Brannick device, measure 3 different measurements. The first measurement does hold some value, and that is going to give you an overall measurement of your foot, and that's going to be given in a letter. The second measurement that's given with this device is the overall measurement of your arch. And sometimes that can hold some value too, because people can have long arches and short toes, or correspondingly short arches and long toes. So those first 2 measurements with this system do hold some value. The problem with the third measurement, the width measurement, wherein this device will render a letter to go along with your number, this is where things go wrong. The width measurement that is derived from this device is at the ball of the foot. So if you care about medicine and you care about your health and you care about fitness, I'm going to discourage you from using this system to fit your footwear. In fact, the thing that I share with most of the folks that come to see me, most of whom are athletes, is a little known fact about this device. This device was designed to fit fashion footwear. It was not necessarily designed to fit performance footwear or natural footwear. And I've got a much better way to show you folks here in a couple of slides that is better than rendering a number in a letter and squeezing your foot. It's actually a way that you can use your own eyes and your own senses. In fact, maybe while we're in the webinar today, some of you can check your own footwear if you're wearing footwear. If you are wearing footwear, I would encourage you to go ahead and kick them off while we're visiting. That's one of the very most potent things we can do to help our feet, is just wear shoes as little as possible. So avoid the Brannick device if you can. Interestingly, about a year ago, I came down to Los Angeles to go to the Footwear Innovation Summit. And I was quite excited about that, because as I've learned to care for people's feet, I've realized that you also have to be knowledgeable about footwear if you're to truly take good care of people's feet. So when I heard that they were showing some 3D imaging and some 3D scanning systems to develop shoe sizing and foot sizing, I got excited about that. I took a friend of mine, a shoe designer that used to work for Nike, down there with me, and we both had our feet measured with this new 3D imaging system by a company called Volumental. And so you stand on a little platform, and the technology scans your feet, and it renders this image, and then it also renders the sizing measurements on the right-hand side of the screen. The problem with this new system is it's actually just a 3D version of the Brannick system. In other words, this system is also going to render the letter and attribute width to the ball of the foot. So to help you understand why we also are going to discourage from using these new 3D scanning systems, when I got back to Portland, I had my team order me some shoes based on these measurements that came from the Volumental. So we bought a Brooks Adrenaline 10.5 double E, and we bought a Rockport men's shoe 10.5 double E. And If you notice on the left-hand slide, the yellow line there correlates to the sock liner, which is that yellow piece of foam underneath my foot. Now, many of you listening are familiar with the reality that a lot of shoes have a foam piece called a sock liner or an insole that you can remove. And this is how I'm going to encourage all of you to fit your feet and your clients' feet and your family's feet going forward is the slide that you see on your right. In other words, if I hold my feet in its natural corrected position with toe separators, which we'll talk a little bit about this morning, I'm not going to be able to have my feet naturally positioned in the Brooks or the Rockport. However, if I have my feet naturally positioned and do this sock liner test, also known as the insole test, standing on a natural shoe, which is widest at the tips of the toes, the example I show here is the Lems Primal 2, you can see that my whole natural foot spread widest at the tips of the toes is actually on the sock liner. We would consider this best case scenario for fitting your footwear. So that would be how we would encourage you to look at your footwear. Abandon the Brannock device, discourage people from using it, pull the sock liner out. In a few slides, we'll show you how to evaluate a shoe that does not have a sock liner in it, as a lot of shoes these days are coming with one either glued in or not even having made one at all. So one of my good friends is Golden Harper from the Ultra Shoe Company. About 10 years ago, he did something very courageous and brave and decided to make shoes that are actually shaped like human feet, widest at the tips of the toes. And to the left is one of the graphics that his company came out with, showing x-rays of people's feet inside of the traditional toe box shoe on the left, and you can see the toes are kind of squeezed in, especially the fifth toe. However, they also took an x-ray of a natural healthy foot inside of a shoe that is not pinching the toes to be narrower than the ball. And this is a fairly telling graphic, which will show several similar graphics later on. But one of the things that we encourage people to avoid as much as possible is the tapered toe box. It puts the toes into an unnatural configuration, and it contributes to the 5 problems that you're going to see at the bottom of the slide. So when I came through podiatry school, we were taught, and many people still believe this, that a shoe should really be rigid and supportive. In other words, it should not bend in the middle. It should not twist torsionally. The only place it should bend is where you see us bending this shoe here at the ball of the foot. We were also taught that it's supposed to have a stable heel counter. So in other words, if you squeeze the back of the shoe, it's not supposed to bend at all. The problem with this is it's been rigorously studied. There's a lot of medical literature that has looked at, is there any evidence or proof that this kind of a shoe actually will benefit an athlete or an active person? In fact, one such study is on our website. The title of it is your distance running shoe prescription evidence-based? And it's done by Dr. Craig Richards from Australia. And by the way, when we talk about articles and studies and so forth, you folks will all have copies of that so you can see what we're looking at. But essentially, this kind of a shoe will lead to muscular atrophy and dependence upon supportive devices. We're going to recommend a different kind of shoe, and we'll show you some examples of what would truly be healthy for you. So what I really encourage people to think about when they have a shoe like this is to envision how their foot is positioned inside of this kind of shoe, and to notice how different that is from standing on your bare foot. When you stand on your bare foot, most of you listening are going to balance part of your weight on your heel and the other part of the weight on the front of your foot. When you put on most athletic shoes that are built like this, with the back end twice as high as the ball area, and the front end holding the tips of your toes up, which is called toe spring, hopefully you can all conceptualize that this is how your foot resides inside of your shoe. And if the shoe is stiff, you are not able to bend your toes down, your heel will never go level with the ball of your foot, which is natural. So if you think about seeing these kinds of shoes on the wall, you can now have a visual to help you understand how your foot would be positioned inside of the shoe and how it would function. Not so surprisingly, most people that wear this kind of shoe will get an injury. Some of the common injuries are listed at the bottom of this slide. There's been some compelling studies looking at this. One such study showed that if a runner buys a shoe like this and runs in this kind of a shoe for a year, an inordinate amount of those runners are going to have an injury for every year of running that they run in this kind of a shoe. And I was this kind of a guy wearing that kind of shoe since 1983. And not surprisingly, when I first started running, I promptly got injured. And that has a lot to do with why I'm passionate about sharing this with all of you and helping you to avoid some of the mistakes that I've made. So avoid the tapering toe box, avoid the rigid toe spring. And again, that's where if you look at the shoe, the tips of the toes of the shoe will be higher than the ball of the foot. Some shoes will have a toe spring built in, but the shoe is flexible. And so when you stand in the shoe, your toes will come down to the support surface. That's fine. It's the rigid ones that don't let your toes engage the ground surface that could be incredibly bad for us. So as I mentioned, I'm going to talk briefly about some of the literature that's been out there. Some of you may be surprised to learn that some of what I'm talking about today has been around for 100 years. I'm also humbled and excited to share that none of what I'm sharing with you today was invented by me. I'm going to share a couple of wise doctors that have known this for decades. This doctor, Dr. Hoffman, traveled around the world in 1905, and he compared the feet and the foot problems that he saw in barefoot cultures with the problems that we see in industrialized cultures. That paper is kind of a long paper. It is on our website. I've got a slide here and a couple more slides where a group of 4 of us got together and we rewrote and reprinted Dr. Hoffman's article in a condensed version. That can be found for free on the Natural Running Center website. So that would be a good resource for you guys to look at too, to hear about what has been known about what we're talking about today for well over 100 years now. So the graphic to your right was on the title page of an article that changed my mind and it changed my podiatry practice overnight. The name of the article is Why Shoes Make Normal Gait Impossible by Dr. William Rossi. 4 of his articles are on our website. We paid copyright privileges. You guys can reproduce them if you'd like. But when I saw this graphic and I saw the title, I decided I was really intrigued by why shoes could possibly make normal gait impossible. And this graphic was very compelling to me, and hopefully it will be to you as well. The lady standing to the left of the graphic is standing in her bare feet. Her entire body column is in alignment, good posture. And then in the middle of that slide, we put on a 2-inch heel. And obviously that lady is not going to walk around like the Leaning Tower of Pisa. She is going to make some alterations in her core and her spine, as well as her ankle. And unfortunately, those alterations are going to not be healthy for her. Sure, they're going to allow her to stand up straight and walk, but unfortunately, they're also going to contribute to many of the issues that you see on the left-hand side of the screen. So if you get a chance and you're interested in reading what Dr. Rossi wrote about, this would be a fantastic article to read. There's also an article below Dr. Rossi's article, which I think you might want to know about. The Journal of Investigational Biology took 2 groups of ladies. One group of ladies functioned on their bare feet, or I should say a flat shoe, for 1 year. Another large group of ladies wore a 2-inch heel for 1 year. They then did an MRI study of both of those groups of ladies, and the 2-inch heel group of ladies had a 13% shortening of their calf muscles. So I've already spent time this morning talking to patients about Achilles tendon problems. And so one of the negatives about wearing shoes with elevated heels, which by the way, most shoes have them, not just fashion shoes, most athletic shoes have higher heels, is that they're going to contribute to the problems that you see on the right-hand side of the slide here. So that's another thing to try to avoid the tapering of the toe box, try to avoid a rigid toe spring, and then also try to avoid a heel elevation. And we'll talk a little bit towards the end of the webinar about how to bring about these changes in your body, because since most shoes are built like this, it would be a very bad thing for me to recommend that all of you all of a sudden just go out and get a natural shoe and start living your life exactly the way you are now. That would be a recipe for disaster. So we'll talk a little bit about how those of you who are interested in pursuing your own foot health and that of your clients can safely bring this about. So again, here's another Dr. Rossi graphic that shows what happens when a person's in their bare foot. the length of the calf muscle, the length of the Achilles tendon. The other thing that they found in the article listed again here is not only were the calf muscles 13% shorter, the fibers of the Achilles tendon were thickened and overlapped. So not a good thing that any one of us should be doing to our bodies. Unfortunately, the second issue that you see here, retrocalcaneal exostosis, was actually my first real running injury in my foot when I went to college. My first year of college, I wasn't a very good runner, so I didn't get a very expensive shoe. I got a $50 Gel 100 that didn't have any technology in it. It was just a little bit of foam. And I had a pretty good freshman year. So my coach said, well, now you're running better. We're going to increase scholarship and I'll buy you whatever training shoes you want. And as a 19-year-old, my mindset was, if coach bought me more expensive shoes, they're probably better. I'll probably run faster. So that's what I asked coach to do. Well, unfortunately, one of the features of more expensive running shoes at that time was that they did have a stable, rigid heel counter. And unfortunately, I developed this really red, hot, swollen, painful bump on the back of my right heel. I went to the training room, I iced it, I ultrasounded it, I took a lot of Advil. It didn't get well, so I went to the orthopedic surgeon twice. I got 2 different cortisone injections, didn't help it at all. I went back for my 3rd visit with the orthopedic doctor, who told me that he felt like I should probably have my Achilles tendon cut from the back of my heel bone, and then I should have part of the bone removed and my Achilles tendon reattached. And I kind of freaked out a little bit about that, and I asked coach if I could avoid that, and so he agreed, and we redshirted. Well, a few weeks after that, when the team was at North Carolina State, I was sulking in my dorm room, and I happened to look in the back of my closet, and I saw that the heel counter of all of my right running shoes had worn clear through the soft material down to the plastic. And I had a light bulb moment. I put on one of those shoes, and I noticed that the hard plastic rubbed on the back of my heel exactly where I developed this red, painful bump. So even pre-podiatry, I learned a very valuable lesson, an unfortunate lesson, that my footwear was hurting me, and an even more valuable lesson that much of the medical community had no interest in evaluating my footwear. They were treating me. And this is what I was trained to do in podiatry school. However, I think there's a much better way, and that's prevention, and that is a component of the MedFit. So we'll dive into some prevention here shortly, but this is another one of the things that is going to take people out of their game, is these shortened calf muscles. So I used to work for an orthotics lab, Northwest Podiatric Labs and Superfeet, for about 5 years. And not only did I notice that when people stood on the orthotic, just like we would have them stand on the sock liner, which I'll show you more slides in a moment, 90% of the people whose orthotics I was making for them, or the Superfeet that I was selling to them, had feet that were wider than the orthotic or the Superfeet. And when I discussed this with the marketing members and the CEO of Superfeet, they mentioned that the Superfeet and the orthotic basically have to be the shape of the shoe that's in the marketplace. And that's when I realized 2 wrongs are not going to make a right, and I resigned from that position. There's a lot of good literature out there right now that is looking at the weakening effects of orthotics and supportive shoes. So some of the negative things that can happen with long-term chronic partial or immobilization of the foot are listed to the left-hand slide. And one of the interesting ones is, those of you who are familiar with orthotics have seen a lot of these are rigid, heavy, thick. And there's some good studies out there now too that indicate you don't want to be putting more weight in your shoe, because that's going to increase your oxygen consumption. So try to avoid artificial arch support. There truly are people that need arch support. In my practice population, there probably about 5% of the patients that I see. If we have time at the end of the hour, I can certainly go into who might be an appropriate candidate and who should avoid it. But I think for the most part, most people should be strengthening their arches as opposed to supporting their arches. This is what the literature is encouraging. And I'll show some of those folks, some of those strengthening exercises for you folks here in a few slides. So in 1998, I'm completing my 2nd year of surgical residency here in Portland, Oregon. And about 10 times a week, we're doing an operation known as a bunionectomy. And so for those of you in the audience that are not familiar, A bunion is when your big toe starts going over towards your second toe, and many times the second toe will come up on top of the big toe. And this was happening in both of my feet at a time when I was operating on many people who also had this in their feet. And towards the end of that 2 years of doing many of these, I began to be troubled with one of the components of this operation is to actually cut a fairly significant muscle off of the inside of a person's toe bone. And that muscle is known as the adductor hallucis. Because of tapered toe box shoes, that muscle gets very short and very contracted, and it basically overpowers the big toe and pulls it over towards the second toe. So one of the ways the operation tries to get the big toe to go back is to release that muscle. And although I was very familiar with that operation, I did not want to have that done on my own foot, mostly because I'm an athlete and I had the apprehension that maybe it wouldn't work and maybe I wouldn't be able to run. So I was heavily influenced by the physical therapy community to take a slower therapeutic approach to stretching that muscle, the adductor hallucis muscle. And some of Dr. Rossi's work encouraged that. I realized two things at that time. I realized that I needed to start putting something between my first and second toes. So I bought the single silicone spacers you can get at the pharmacy, and I started putting them between my big toe and second toe, as well as between my fourth toe and fifth toe. And I noticed that my bunion started slowly resolving, and I noticed that my second toe sat back down where it belonged. And whereas my fifth toe was curled in under my fourth toe, I began to see my toenail. Also, my body started feeling better. Some of the aches and pains started resolving. I was taking less medicine. And so I started talking to my patient population about this. And they were intrigued and excited and didn't want to have operations. But the second thing we realized was if we put these spacers on and got our toes back out into natural position, we had no shoes to put these into to do our runs in. The Nikes, the Brooks, the Reeboks, the Adidas of the world all have tapering toe boxes no matter how wide you go. So at that point in time, this is, think around year 2000 probably, we had Brooks and, or not Brooks, we had Birkenstocks and we had Crocs. So as goofy as we looked and as ridiculous as it sounded, we all did our training in Crocs. As a matter of fact, I ran my fastest Portland Marathon in a pair of Crocs, and I ran the next day because it didn't hurt my body like running in conventional footwear had. So super interesting, cluing into my own body, pain is going away, toes are getting straighter, but every time we would go run, the single silicone spacers would not stay in place. So I had a buddy of mine design what you see on this slide, which is correct toes, which I invented to basically get my own bunion straightened out, which it has done. So that's my shameless plug for my own product. And if you guys have questions later on, we can certainly cover those. There's a lot of information on the website, and we'll give contacts at the very end too. So when they're worn over bare feet, they get your toes back out to natural. They promote balance and optimal foot health, as well as toe circulation. We've got some great graphics to show you here in just a moment. And whereas I usually spend an hour with this presentation, we've only got 45 minutes, so that's why I'm kind of rushing through things. So an energy auditor from Spain purchased correct toes, put them on one foot, not the other, put them on his right foot, but not his left foot. Spent the next hour just moving around his home. And he uses a very special camera to sense temperature. And this is how he helps building managers determine where buildings need to be repaired to stop losing energy. Well, as you can see from some of the graphics, the foot that he used the correct toe spacer on got blood out to the very tips of the toes, which rendered the temperature 5 degrees warmer Fahrenheit at the tips of the toes. So if you guys know people, I'm sure you do, with cold feet, maybe some of you have cold feet, you might have heard of the condition known as Raynaud's disease or Raynaud's phenomenon, or some of these cold-induced injuries that people get. One of the very best ways that I know how to get blood down there is to actually open up the blood vessel channels where they should be opened up. Now, this is a fascinating feature of anatomic reality, which is those blood vessel channels, your artery, your vein, your lymphatics, and your nerves all need to branch at the ball of your foot. So in other words, the artery that comes down between your first and second toes branches into your first and second toes. But ironically, tapered toe box shoes squeezes toes to become the widest part of the ball and consequently robs people from getting blood all the way out to the tips of the toes. This is also a feature, a reason why people sometimes take longer to heal with some of their foot injuries. There was also a fantastic study that came out of the Journal of Foot and Ankle Research just last year, where they documented with ultrasound that if they took a person's big toe and pushed it over towards the second toe, a position, a movement called abduction, they showed through ultrasound that 20% of the blood flow was inhibited getting into the bottom of the foot. So believe it or not, although we don't give our toes very much respect, they really are where a lot of the action is in terms of our overall body health. And for that reason, I'm really going to implore you folks to really respect and pay attention to your own toes and how they fit inside of your footwear. We're also a huge fan of metatarsal pads. So whereas we don't necessarily use many orthotics and arch supports, we do like to use metatarsal pads because these help to bring the fat pad back in under the ball of the foot. They help to shorten the length of the plantar fascial ligament so it doesn't get tensioned and torn. They also help to put the little tiny arch muscles into what is known as their proper length to tension relationship so that they can be functional. And I've got a slide here in a few moments that's going to depict the length to tension relationship. They're a very simple, non-obtrusive $10 pad. You can order them online. You can order them on our website. Those of you that are providers listening, you can set up your own wholesale account and retail them to your clients and patient population. But a very, very potent strategy here. A good friend of mine, Jay DeSherry, is a physical therapist, lives in Bend, Oregon, has written 2 fantastic books for those of you that are really interested in this kind of stuff. Anatomy for Runners was his first book. Running Rewired came out a few years ago. But Jay realized that there was a need for a better tool to engage the toes properly and to balance at the same time. So although Jay doesn't pay me to talk about his mobile board, I'm a big fan of it. I'm sure you could probably purchase it somewhere online. Maybe we have a link on our website. But I've had a lot of fun with this. My patients have fun with this. So this is a nice strategy that you guys might want to use to improve your balance. And if I didn't mention it already, or if I don't have it in a future slide, I'm very excited and proud to say that we are just about to publish a study in the Journal of Sports Rehabilitation, where we showed that if people get their toes spread out and wear a thin-soled shoe where they can feel the ground, their balance is statistically better than people that try to do a balance maneuver in their conventional shoes. In other words, we took three groups of people. We took the first group, our control group. They didn't change anything. They wore their conventional shoes with a higher heel, stiff sole, taper and toe box, rigid toe spring. Our second group wore a LEMS shoe, the gray shoe I showed earlier, but they didn't spread their toes. The third group wore LEMS and spread their toes. And the third group was statistically significantly better in all parameters of balance, even after they removed the correct toes. So that should be in print here shortly. So our toes are super important, you guys. And if we can engage them and properly position them, you won't be disappointed in the outcome. I'm also getting very excited about what is also being heavily studied right now, proprioception. So whereas when I came through podiatry school, it was largely orthotic therapy based on outdated biomechanical theories as well as surgery, these days, the emphasis is moving away from a lot of that towards not only strengthening, which I'm super excited about, and I'll give you some resources here in just a moment, but people are also intrigued with this idea of stimulating our nerves in the bottom of our feet, which are sensory organs. And actually, this input is very, very valuable for teaching our body where it is in relationship to the ground and space. And that's basically what proprioception is. So I've got a podiatrist friend in New York, Dr. Emily Splickle, who has designed a product on the top known as a Naboso insole. So in other words, it's a textured insole that you put inside of your shoe that stimulates these nerve endings in the bottom of your feet and sends very precise, clean, proprioceptive information to your brain, because the better that information from between your feet and your brain, the better your brain can govern how your body holds itself, balances itself, and moves you all around. The other options that are coming out now, which are really great, are a variety of different mats. Vigorous spike mats are one of my favorite ones here. My friend Dr. Stephen Bowie has Conex mats. This is what I stand on at my standing workstation. Wonderful way of activating and stimulating your sensory nerves, of which we have about 200,000 in the bottoms of our feet. So you don't want to overly insulate them with thick padded shoes. So I would encourage you guys to just start taking your shoes off from time to time, go completely barefoot. As you get stronger and stronger, begin exploring your world in your bare feet. But when you can't do that, you can either put in an insole in your shoe, or you can stand on one of these mats and you'll get a good experience. So here's several exercises that we like and we teach in our clinic. However, as popular as the short foot one on the top left is, it's also called Janda exercises, or doming of the foot. As popular as it has become, it's my recommendation not to begin doing this unless you can do the stretch right below it. Now, the stretch right below it is my foot. I'm taking my own toes and I'm bending them under the ball of the foot. And you might be interested to know that in 1999, I could not do this. I could not flex my toes downward at all. My children were born shortly thereafter. Babies can flex about 90 degrees. I've worked myself up to about 75 degrees. But the point is, if you run your client through the toe extensor stretch and they're not able to flex, don't have them do short foot, because short foot really is flexing your intrinsic muscles. So short foot's up above, and really what it is it's keeping your heels and your toes absolutely stationary and gripping with those small little arch muscles. So it's kind of like making a fist with your foot against the ground. We also pass out a hacky sack to everybody that comes to visit, and we ask them to begin engaging those very same muscles in the central top graphic. So you can get a little hacky sack, you can get a super ball, golf balls, just start grabbing and using your toes. What's fascinating is if you have the benefit of observing a baby in your day-to-day maneuverings, you'll notice that babies can spread their toes and their fingers. Everybody listening can still spread their fingers, but most of you listening probably can't spread your toes. And that's because the muscles that spread your toes have not been engaged for most of your life. The literature is very, very encouraging also in toe spreading. And so you can do it either by starting out with gripping your big toe and then fanning your foot out, as Rebecca is showing here, or you can start with your fifth toe and fan your foot out towards your big toe. It doesn't matter. They're also very, very effective. Don't be surprised if your foot feels early on like it doesn't know how to do any of these. And that's what most people express. And that's because your feet aren't able to go through these positions in most of the footwear that most of you have been wearing. You can also dig into a hacky sack or a golf ball or a super ball or even just the ground. And furthermore, Jay DeSherry likes to recommend the bottom right slide. He calls it toe yoga, where you can independently lift your big toe off the ground while stabilizing your lesser toes. People that get really good at this can also stabilize their big toe and then lift their lesser toes off the ground. Again, most people that start this will just stare at their foot and their brain has no connection to know what to do. But I promise you, if you keep thinking about it and staring at your foot and working at it, your brain has a distant memory of these neural circuits. So you can waken them back up again. And it's a very potent and powerful thing to get more in touch with your feet. So a couple features about natural shoes versus unnatural shoes, because I think we're winding down to probably 3 or 4 minutes left. The typical shoe that you're going to see on the shoe wall is going to have a tapered toe box like the one on the left. It's going to be widest at the ball and getting progressively narrower. It's going to have a rigid sole, which means it's going to be like the graphic earlier where you try to bend it and the shoe doesn't bend. It's going to have a 2-to-1 heel elevation, which is typically normal. It's going to have a rigid toe spring. Those are features that you're going to want to start progressively eliminating from your closet and from your wardrobe. Shoes on the right demonstrates that the footwear is going to be widest at the tips of the toes, not at the ball. It's going to be flexible throughout. It's not going to have a heel elevation. When I first read about this concept, it was before the term zero drop came out, which was coined by Ultra Footwear. My mentor, Dr. William Rossi, just talked about flat footwear, flat from the heel to the very tips of the toes. Nowadays, it's known as zero drop. And so you can see as you look at the lateral graphic, the slide there, no heel elevation, no rigid toe spring, and it's a flexible shoe. So those would be the types of features that you're going to want to start slowly merging into your day-to-day activities. So we want it to be lightweight without support features. We want it to be flat from the heel to the tips of the toes. So again, no rigid toe spring. You want to be able to bend the shoe all about. You've got 33 joints in each of your feet, 25% of the bones in your entire body in your feet. And then we also want it to be widest at the tips of the toes. So that's what a natural foot, that's what natural footwear is going to look like. So here's some of the literature. Another great study just came out this past year, very similar to the ones that you're looking at here. They took people in conventional footwear who had weak feet and they progressively moved them to shoes like either the Vibram 5 Fingers or a shoe like you see here, the LEMS, and they either did MRI studies of the arch muscles or they did ultrasound studies of the arch muscles. And most of these studies are fairly consistent in obtaining between 8 and 10% of muscle hypertrophy or strength gains. And everybody listening to this would probably agree that stronger muscles are healthier muscles, and I absolutely agree too. So some very intriguing literature to look at for those of you that want to go on the deep dive. So here's Jay's graphic in the top left here, the length to tension relationship. And this is very important. Most conventional footwear will actually hold our heel higher and the tips of our toes higher, which over lengthens the length to tension relationship. So unfortunately, if it's over lengthened, the little arch muscles cannot flex the foot. What we really want is the central portion of the graphic here, where the foot is flat and level and we can actually flex the foot. So this is what you will be able to achieve if you get in footwear that is zero drop and allows your toes to engage the ground. Here's Dr. Hoffman's article again. Here's the rewrite that we did in 2013 that again you can obtain from free on the Natural Running Center website. And I'm going to have to apologize to you guys because ordinarily when I give this presentation, I don't have the prompt that I have on the right-hand side of my screen, so I can't see exactly what I wrote here. But basically, you can see what the shoe looks like, and that's the type of shoe that I'm going to encourage you folks to start pursuing. Again, you want the shoe to bend because your foot is mobile. And so if the shoe bends like this, you know that it's going to engage your feet. If your feet get engaged, your muscles are going to get stronger. If your muscles are going to get stronger, your whole body is going to function better. Again, widest at the tips of the toes for so many reasons, but circulation is a huge reason. Nerve function is another good one, and balance. If I could urge you folks who are listening to take one very important piece away from our talk this morning, it would be what you see here. Of everything I've discovered in my 25 years of studying feet and looking at feet, I think the one thing that I've learned to pass on to you that will overwhelmingly help you and your client population would be to teach them the shoe liner test or the sock liner test. Shoes are made all over the world. If you buy a size 10 from one company, it's going to be different than a size 10 from another company. So attributing a number and a letter is not the best way of sizing your shoes anymore. So my encouragement to you guys would be to size your feet based on the shoe liner test, also known as the sock liner test. Here's a photograph of one of our patients. This lady happens to be standing on a custom orthotic that was made for her. And you can clearly see that, excuse me, if this orthotic is going to go in the shoes that she wears, her big toe is not going to be in this nice, straight, pristine, natural position that you see here. Her big toe is going to get pushed in a bunion configuration, and that's going to begin the lack of balance, the lack of blood flow, the pinching of the nerves, and a whole host of other problems that don't usually present themselves until later on in life. So here's the money slide for you guys. Take this with you, take this into your world and to your families, and you'll do so much good. So again, here's another graphic of the shoe liner test, sock liner test. Pull it out, either spread your toes or stand on it with a toe spreader. Obviously, give yourself a little bit of length at the ends of your toes. And as promised, the fourth slide here, let's say you have a shoe that you do not have a sock liner or a shoe liner to remove. You could take the right shoe, flip it over upside down, stand on it with the left foot, understanding that the upper part of the shoe is always a little bit narrower than the sole. And that's another way of determining whether or not you're able to spread your toes within your shoes. A couple easy things to do. Most of our clients leave the sock liner out of the shoe altogether. It's just a piece of foam that will give you more volume. You can also lace your shoes farther back. A lot of the lacing systems will be right across the ball again, and they'll squeeze you. You want to fit your shoes towards the end of the day. Your feet can get 15% bigger by volume just with activity. And you should also be always standing on your feet when you do this test, because feet spread out more when you're actually on your arch. So this is probably the thing I should warn you most about. I hope you're as excited about what I've just shared with you as I am, and I have been. However, the excitement to transition to barefoot activity, natural footwear, what is sometimes called minimal footwear, has the potential to cause a lot of problems if it's done improperly. There was a book called Born to Run that came out many years ago where they went down to the copper canyons of Mexico and they observed a tribe that basically straps a piece of tire rubber to the bottom of their feet, and they come to America and win 100-mile races in their 50s. So what they discovered from these people is they don't pinch their toes, they don't lift their heels, they don't lift their toes, their footwear is not rigid. So when you see these people in their 50s, their feet still look like a baby foot. I've seen this myself. I lived in Liberia, West Africa. The old people's feet look like a baby feet. I've been to Asia, where people that live rurally have the baby-shaped foot. Same with South America. So realistically, most Americans that read that book or hear something like what we're talking about today, it sounds logical. It is natural. It's got a lot of benefits to it. But I promise you, if you rush this, you'll get hurt. So we do have some slides or some graphics somewhere on the website that actually boil this down to a little bit more detail, but I would just urge you, think of this as lifestyle changes or lifestyle medicine. Think of giving yourself a year or more to just experiment, letting your body get used to being in more of a natural shoe. Here's a couple of examples of natural shoes. We've got a shoe list on our website. Notice everything's flat. If you were to grab these shoes, they're flexible, they're foot shaped. And again, we've got lists. We do shoe reviews regularly. So we've got these resources here for all of you. Each of you will get access to what you've heard today. Our Correct Toes website's on the top, our clinical website's in the middle. And I'm really excited to also share with you guys that a group of 4 of us have recently started what is known as the Healthy Feet Alliance. We've also got a Facebook group as part of the alliance called the Healthy Feet Community. We would invite every one of you to come join us. We basically try to partner with everybody that has a role in this arena. Doctors, health specialists, athletes, footwear companies, teachers, trainers, etc., coaches. So anybody listening is more than welcome to get in on this. And we're really just trying to help everybody in the world to have healthier feet and healthier bodies. So I thank all of you very deeply from the bottom of my heart for spending this time. And I also hope that you find benefit in this. Please reach out to us if we can help in any way.